Good evening. My name is Sharon Knowles, and this evening I would like to speak to you today about euthanasia. Let's start with the definition of euthanasia, or mercy killing. It refers to the practice of terminating a person's life by removing life support or through lethal injections, lethal drugs, with the intent of relieving him of pain and suffering that comes with their medical condition. Death caused in such circumstances amount to passive euthanasia, which is not illegal. Out of the 50 states that make up the United States, only 4 actually have provisions in their judicial system for the euthanasia law. Of the 4, out of the 4, there consists of Oregon, Montana, Texas, and Washington. Of those 4, Oregon is the only one that it was the first to introduce the euthanasia law with connection with the Death by Dignity Act in 1994. According to this act, people who are terminally ill with no chances of survival whatsoever may ask their doctor for lethal medications. Even though active euthanasia is illegal in the United States, the patient do have the right to refuse medication. On the other hand, when the person is put to death by means of some lethal drug, it is referred to as active mercy killing. Like everybody has the right to live, everyone should have the right to choose when to end their lives. This is one of the most prominent arguments put forth for those who support euthanasia. Sometimes people mention in their wills whether or not they want to, that their families have the right to say that they could live or die, or have them released or just removed from life support. That is all usually included inside of their wills. An individual should have the liberty to choose death if he is suffering from incurable diseases, where even the best treatments doesn't improve his quality of life. What would happen when a patient is allowed their decision to end their life? Legalizing euthanasia would help suffering in terminally ill patients. It would be inhumane and unfair to make them endure such unbearable pain and suffering. Euthanasia should be a natural extension of patient's rights, allowing him to decide the value of life and death. Maintaining life support system against the patient's wishes is considered unethical by law as well as medical philosophy. If the patient has the right to discontinue treatment, why wouldn't he have the right to say that if he wanted to die or to end his life or shorten his lifetime, to escape all the anguish and pain and suffering that comes along with their incurable disease or their medical condition? Isn't the pain of waiting for death more traumatic than actually just allowing them the right to die? There are several ways to carry out euthanasia. One of the most used method is through lethal injections. In Oregon, the most used method is through lethal medication. The most common use is drinking of 10 grams of pentobarbital, or dissolving 10 grams of sacrobarbital into water or either applesauce. The outcome is allowing the patient the right to die with dignity. Healthcare expenditures is always and always will be a big concern for a family, irrespective of the euthanasia law. And only the ones who can afford to prolong treatment or unproductive treatment and the suffering with their loved ones will continue to do so. Anyone else will have to suffer. So why not give them the right to die with dignity? Next coming up will be Christopher, and he's going to speak to you about the actions and conclusions of euthanasia. Thank you so much for your time, and have a wonderful evening. Goodbye.